In my clinical practice of orthopedic surgery, I have the opportunity to care for patients with many different shoulder, neck, upper back, and lumbar spine abnormalities. These conditions many times are not surgical problems, but conditions of inflammation and muscle spasm in the muscles in these areas of the body. Frequently, we utilize the assistance of physical therapy for massage therapy as well as other modalities, techniques that will help these patients recover. This diagram shows the areas of myofascial inflammation where we frequently can see strains or sprains or muscle spasm in the area of the shoulder girdle, behind the shoulder, showing the muscular attachments in many areas of the soft tissues that become inflamed and can be a source of irritation for the patient. Many of these patients that I see don't respond simply to prescriptions and medication, and we have to utilize the expertise of physical therapy. I frequently refer patients for massage therapy as well as physical therapy modalities to help these people restore themselves back to a normal functioning condition.
The benefits of therapeutic massage are clear. Moving to a clinical setting, we can see the practical application of those benefits.
In my physical therapy practice, I have found the G5 machine to be very effective in massage therapy. The benefits of massage are to flush edema, to break down scar tissue, to relax muscle tissue, and to help relax the fascia. The nice thing about the G5 machine is that the vibration blocks pain signals to allow me to work deeper into the tissue without hurting the patient. It also helps to flush waste products out of the area, and it is very durable and powerful and effective, so I can use it all day long without any problems. I have one of these machines for every single one of my tables because I believe in it so much. Each G5 machine has a patented orbital and directional stroking action. The G5 product line has a variable speed range of 20 to 60 cycles per second and uses many interchangeable applicators to treat specific conditions. This patient has a rotator cuff strain, so I'm using a lower frequency on the G5 machine to get into the tissue. I'm using the G5 machine over my fingers with a towel cushioning my fingers and guiding the vibration with my fingers into the tissue. The tissue will not respond to rehabilitation unless it's relaxed and flushed of waste products, so it's incredibly important for a therapist or a trainer to work through the tissue, free it from waste products before strengthening. Now I'm feeling some trigger points in the tissue, so I'm going to switch applicators. I'm just going to use this applicator to get the trigger point out. The G5 is used in more than just clinical settings. It's also used with athletic trainers and athletes of all levels.
As Strength and Rehabilitation Coordinator for the Houston Oilers, it's my primary responsibility to take care of the athletes. As strength coach, I implement programs to make sure that injuries don't occur. But you can guarantee that in professional sports, injuries will occur. As rehabilitation coordinator, I try to do everything I can to make sure that the athletes are available. Remember, ability does nothing if there's not availability. So what we do is implement programs to take care of an athlete once they're injured. Normally when an injury occurs, you have to go through your normal protocol: history, inspection, palpation, functional testing, neurological testing. And that's where massage comes in. Right from the onset of the evaluation, in palpation, you need to know massage techniques to properly evaluate an athlete. And that's what I'm going to show you now. If you go ahead and lie down. In palpation, you have to be familiar with the anatomical body. You have to be familiar with tissue. And what I do is I start with the unaffected limb and I do an evaluation, building up from what the athlete has told me and try to evaluate exactly what may be going on. I palpate and massage the tissue, looking for any abnormalities, and compare it to the affected area, looking for any swelling, gross deformities, and defects. Following a comprehensive evaluation, massage therapy plays an integral part in the total rehabilitative package. We use the G5 unit with its applicators throughout several different phases of the rehabilitation program. In the early phase, we want to assist lymphatic flow. We want to assist the venous return to the body. So we use the U-shaped applicator. And as Ashley mentioned earlier in the film, it has several different frequencies and cycles that can be used. And we use a low frequency of cycles to help with lymphatic return, and venous return. And as you notice, we'll start distally and move proximally. Now, it does not have to be a hard, deep stroke. You can just apply pressure and gradually move up the extremity and let the machine do the work. Now, when the injury has moved from the acute stage to the subacute stage, often symptomology will appear and manifest itself with trigger points. And that's where there'll be spasms located throughout the muscle area. So what we do is we evaluate it and we find the areas of trigger points. We may mark them with a pen or keep our fingers over them. And at that point, we'll attach a trigger point applicator. And again, we'll stay at a low frequency and apply direct pressure over the trigger point site. Now, one of the techniques that I like to use is a split finger technique, because then my hand can feel the release of the trigger point. I will get directly over the site and put direct pressure down, getting feedback from the patient for patient tolerance. And once I feel the release, I move to another site. Now, if I stay there more than 10 to 15 seconds and I don't feel a release, I will move to another trigger point and then readdress the first trigger point. I usually follow up this application of trigger point therapy with a general muscle relaxation technique. And that's when we use the multi-pronged applicator. And I'll go to a higher frequency, higher cycles, and apply it distally to proximally throughout the whole affected muscle. Again, putting direct pressure down, letting the machine do the work. On game days, I have approximately 4 hours to get 45 players ready for game day situations. So often, 30 of those players will require some sort of massage therapy. So on game day, often what I'll do is do a shotgun approach. You can imagine having to deal with 30 large athletes. Quickly, my hands would fatigue out. The G5 gives me enough power to last for those 4 hours and get all the massage done. One of the techniques that I use is muscle stimulation on game day. And that helps just kind of bring continuity to the total rehabilitative process we've been using all week. And in that technique, I use a higher frequency with direct pressure and massage the total muscle from its origin, insertion. I start distally and work back proximally. And to keep continuity with massage therapy while the players return home, we use the G5 Pro Power Massager, and we'll send this home with the athletes. And one thing unique about this device is that it has the patented directional stroking motion. And what that does is really help with the effleurage technique to help with the venous return and help with increased circulation. If an athlete can't reach an area, we'll train the spouse or a friend to be able to have the athlete apply the massage therapy at home.
I'd like to take a few moments to briefly recap with you some of the proper operational procedures with our machines and highlight some of the benefits and advantages of the products. In order to achieve successful results with your G5 machines on athletes or patients in training rooms, hospitals, clinics, or at home, it's essential to employ the following operational procedures. Always use the proper applicator and machine speed for each desired objective. To relax small muscle groups and help mobilize lactic acid and buildup, use the G5 number 230 U-shaped applicator at a cycle per second range of 25 to 35 CPS. Move the applicator distally to proximally in a slow stroking fashion. To relax heavy muscle groups in the back or thighs, use the G5 2-ball applicator or 4-ball applicator. Operate these applicators at a cycle per second range of approximately 25 to 35 CPS. To reduce trigger points, use the G5 applicators number 222 or 227, conical shaped. Operate at a cycle per second range of 40 to 50 cycles per second. Apply light pressure for 10 to 15 seconds. Release and reapply. Use slower cycle per second ranges for deep vibratory penetration and use higher cycle per second ranges for tetanizing and for increasing skin circulation. Always maintain personal contact using one hand on your patient to feel the effects that you are producing. Use your other hand, of course, to hold and apply the G5 to your patient. Don't massage like this. Instead, hold the G5 applicator head in one place on your patient and let the machine do the work for you. Hold the G5 lightly. Holding the G5 tightly will quickly tire the arm and hand.
So remember, always use the proper applicator and proper machine speeds for each application. Always use slower speeds for deep penetration and higher speeds for surface effects. Always maintain personal hands-on contact with your patient. Always hold the G5 head in one place, letting the machine do the work. Always hold the G5 head lightly to prevent fatigue. Whether the application is clinical or athletic, the benefits of the G5 massagers are clear, and General Physiotherapy offers the most powerful, versatile, and durable machines available. For more information on the G5 line or any of our accessories, please call us at 1-800-237-1832. General Physiotherapy. We're here for you.